Hello everyone. Now we are going to discuss about the second part of inflammatory mediators, cytokines. So what are cytokines? Cytokines are proteins produced by so many cells, namely activated lymphocyte, macrophages, dendritic cells, epithelial cells, endothelial cell, and some connective tissue cells. Cytokines mediate and regulate the immune and inflammatory reactions. Now we will see the cytokines involved in acute inflammation on the heading of source of production of these cytokines and their action. First is TNF, tumor necrosis factor, produced by macrophages, mast cells and T lymphocytes, act by endothelial cell activation of leukocytes. It activates fibroblasts for collagen formation, and in systemic effects it acts as a acute phase response and has an important role in fever. Tumor necrosis factor regulate energy balance by increased lipid and protein mobilization. By this it's surpassing the appetite. In the cases of sustained production of TNF, there will be decrease in appetite, which is seen in some chronic diseases, and this condition is known as cachexia. Another cytokine is interleukin 1, released by macrophages, endothelial cells and epithelial cells. Most of the action is same as a tumor necrosis factor, but it has a more role in fever, development of fever. Interleukin 6, released by macrophages and some other cells. It is particularly important in acute phase response and systemic effects, which we will discuss later on. Interleukin 17, released by the T lymphocytes. It helps in recruitment of neutrophils and monocytes. And the chemokines, secreted by macrophages, endothelial cell, T lymphocytes and mast cell. They help in recruitment of the leukocyte at the site of inflammation. Cytokines involved in chronic inflammation. Interleukin 12, interferon gamma and interleukin 17. First is interleukin 12, secreted by dendritic cells and macrophages. They increase the production of interferon gamma. Interferon gamma is secreted by T lymphocytes and NK cells, and this has an important role in activation of the macrophages. Interleukin 17, released by the T lymphocytes, and it causes recruitment of the neutrophil and monocytes. Now we will see the major role of cytokines in acute inflammation. So first is local inflammation, role of cytokine in local inflammation. Like interleukin 1 and TNF alpha, they causes increase in vascular permeability, and they will result into the increased expression of the adhesion molecule on the endothelial cell, and later on endothelial cell will help into the releasing of the chemokines that attract the leukocyte at the site of inflammation. Other effect of cytokines in local inflammation is they activate the macrophages or the leukocytes and further release the other cytokines. In systemic protective effects, TNF, interleukin 1, interleukin 6 will responsible for the development of fever. Interleukin 1 and interleukin 6 will responsible for the production of acute phase protein from the liver, and TNF, interleukin 1 and interleukin 6 will increase the production of leukocyte from the bone marrow. Systemic pathologic effects include cardiac output decreases by the action of the tumor necrosis factor. Tumor necrosis factor are also responsible for the increased vascular permeability, and tumor necrosis factor may cause insulin resistance in multiple tissues. So these are the local systemic protective and systemic pathological effects of the cytokines. Now we will discuss about the another category of inflammatory mediators, chemokines. Chemokines are small proteins of 8 to 10 kilodalton molecular weight. They are chemoattractants for specific type of leukocytes. There are specific type of chemokines for specific leukocytes. Mainly we will discuss about the 4 classes of chemokines: CXC chemokine, CC chemokine, C chemokine, and CX3C chemokine. Here C stands for the cysteine residue. See, in CXC there is one amino acid between 2 cysteine residue. This class of CXC class of chemokine induced by interleukin 1 and TNF. All example of this class of chemokine are interleukin 8, CXCL, also known as CXCL8. They attract neutrophil, monocyte, and eosinophil. In CC chemokine, there are some chemokine known as MCP1, eotaxin, MIP1 alpha. They attract monocyte, eosinophil, basophil, and lymphocytes. C chemokine. Examples of C chemokine are lymphotactin, XCL1. They attract lymphocytes. CX3C chemokine. Example of this class is fructalkine. They attract monocyte and T cells. Chemokines mediate action by binding to G protein coupled receptor. Now we will discuss about the another category and last category of mediators of inflammation known as complement system. Complement system is a collection of plasma protein that function mainly in host defense against the microbes and in pathologic inflammatory reactions. Complement proteins are present in inactive form in plasma. Normally they are present in inactive form in plasma. Critical step in complement activation is proteolysis of C3 or third component of the complement system. Now we will see how the pathway, how many pathways involved in the activation of complement system. First is classical pathway, second is alternative pathway, third is lectin pathway. In classical pathway, binding of C1 to antibody like IgM and IgG, they activate C3 convertase. In alternative pathway, microbial surface molecule or endotoxins or cobra venom, they directly activate C3 convertase. In lectin pathway, plasma mannose binding lectin activate C1, which ultimately activate the C3 convertase. C3 convertase proteolyze C3 into C3A and C3V. C3V form C5 convertase with the help of other complement, and the C5 convertase convert or proteolyze C5 into C5V and C5A. C3A and C5A recruit and activate various leukocytes. This C5B, with the help of C6, C7, C8 and C9, form a membrane attack complex, which ultimately responsible for the injury to microbes or the cells or target cells. So this is the complement pathway, complement system activation through classical pathway, alternate pathway and lectin pathway. What are the functions of complement system? There are three major type of function we are going to discuss. First, in inflammation, their role in inflammation, C3A, C5A, C4A, they release histamine, and as we know, histamine plays a very important role in development of inflammation. C5A act as a chemotactic agent. C5A also stimulate the lipoxygenase pathway and result into the production of leukotrienes from arachidonic acid. Another function of complement system is opsonization and phagocytosis. C3V, inactive, particularly inactive C3V, act as an opsonin and stimulate phagocytosis or increase phagocytosis. Cell lysis, membrane attack complex, is responsible for killing the microbes with thin cell wall. Now we will discuss about the complement regulator. If complement goes unchecked, it can damage the host cell also. So there are certain complement regulator. First is C1 inhibitor. It blocks the activation of C1. Deficiency of this inhibitor will result into the hereditary angioedema. Other regulator is CD55 and CD59. CD55 inhibits C3 convertase and CD59 inhibit membrane attack complex. Deficiency of these is seen in the condition of PNH, paroxysmal nocturnal hemoglobinuria, which is a type of hemolytic anemia, which we will discuss later on in the hematology. The third type of regulators are complement factor H. They increase the cleavage of C3b and inhibit the alternate pathway. Polymorphism of this factor H gene is result into the age-related macular degeneration. So we have three classes of complement regulator. First is C1 inhibitor. Deficiency of C1 inhibitor will result into the hereditary angioedema. Other is CD59 CD55 and CD59. Deficiency of these will result into the PNH. And third is complement factor H. Deficiency of factor 8 or polymorphism or mutation in factor H gene will result into the age-related macular degeneration. So now we have completed the inflammatory mediators. Thank you.